just kind of going over some of the main benefits of Chrome Guided Smile, going through the workflow, and then pointing out, again, some differences between Chrome Guided Smile and advantages compared to other stackable systems out there. All right, so let's get started. All right, doctor, thanks for your time. I kind of want to go through some of the steps here of Chrome Guided Smile. Chrome, as far as componentry, it's a very simplistic system component-wise. There's not a bunch of different components that you're kind of working with day of surgery, but of course it's a well thought out, very methodical process to get the implants in, drilling, and then of course your prosthetics picked up. So first I want to go over the delivery of the pin guide and the delivery of this fixation base. So this fixation base, once it's seated in the mouth, it does not come out. It stays in the entire surgery, and then everything stacks into this fixation base and locks in using these 3 chrome locks. So you push them in to engage them and then pull them out to disengage. The nice thing is they don't come out of here, so you don't have to worry about the patient swallowing these. So the first step is you take your pin guide and you plug it into the fixation base, lock it in. Now on a dentate case, the pin guide uses the existing dentition to line up the height of your fixation base to pin it in. This will also serve as your bone reduction guide. On the dentate case, you can see there's a couple of different windows here to verify seating. If it's an edentulous case, this pin guide would have the opposing arch indexed into it, and you would close the patient into it to index it. Or if it's a double edentulous, these pin guides, they kind of lock into each other just like a denture would seat into each other. But this particular case, it's a dentate case. So we seat the pin guide, and then we'll take our drill kit. Now with Guided Smile, we have long and short pins and drills, just all depends on the contouring or the thickness of the bone. Most often there's 4 fixation pins that go into the pin guide. So you have your drill, obviously you drill your pin sites, and then you take your pins and you pin in the fixation base. So once fixation base is pinned in, you'll unlock your pin guide and remove it from the fixation base. And now from here, you're going to extract teeth and reduce bone to a nice flat plane. And I mentioned this stays in the mouth the entire surgery. In the demo, of course, I got to switch to our bone reduction model. So I will pop this out real quick and then put it back in, of course. So now we have our bone reduction model. Get this pinned in real quick. So you have your bone reduced and ready to place some implants. Now, one thing I want to point out is a couple good benefits of Chrome is the fact that it is a facial only guide. So most of the other stackables out there, there is an aspect on the lingual that it wraps around the lingual to fixate the guide, which means you have to completely fillet the patient open during surgery. With Chrome Guided Smile, it's just a facial seating, so it's just a buccal flap that you perform, and then you do your lingual just enough to get the bone reduction out of the way. You don't have to completely open the patient open on the lingual, which helps for healing and does kind of speed surgery up a little bit because it's less of an invasive flap. Another thing I always point out, especially if you've done other stackable systems out there, is there is a gap between the bone and the fixation base. This gap is on purpose. It's built into the pin guide as you deliver it, so you don't have to figure this gap out. It's already done for you. The reason for this gap is when you submit your CBCT, there could be some potential inaccuracies that show up due to some thresholding of the CT by the designers and the planners. So it just all depends on how they kind of review and perform the thresholding on the CT. Sometimes on a guide that seats directly on the bone, if there's inaccuracies that didn't show up, you have to adjust the bone to seat the guide, or adjust the guide to seat the guide. Once you start adjusting bone or guide, your implant positions are going to be off. So we remove that potential error by having this nice floating guide. And then, of course, the pins here, they are all at different angulations for very nice fixation, so they're not just straight in there. So, fixation and stability of the guide is not a problem at all. So here, as you can see, bone is reduced. Now it's time to verify the bone reduction. We want to make sure we reduced enough bone. So we'll take our carrier guide here, and this does a couple different things. The first is verifying bone reduction. So you seat the carrier guide into the guide, and you lock it in. As long as it seats passively and doesn't get held up, then you've reduced enough bone. If it gets held up somewhere, then you can kind of see where it gets held up, and you'll just adjust the bone at that site and then make sure it seats nice and passive and locks in. So once you verify the bone reduction is good, remove the carrier guide and set that aside. Now it's time to place your implants. For your drilling protocol and your implant placement, it's fully guided. Some huge benefits of Chrome Guided Smile versus anything else out there. It's all metal. There's no flexing, so you can't break the guide. Because it's metal, it's a lot smaller of a footprint in the mouth. So it's more comfortable for the patient and easier for you to work with in the mouth because it's a smaller footprint due to the metal and due to the strength. The plastic guides, they're bulkier because they have to be for strength. Another couple benefits, you can see everything as you're placing the implants, your drilling protocol, you can watch everything going on. And it's very nice irrigation. So it's wide open, so it's irrigating those sites during the drilling is not an issue at all. One more thing I want to point out is the timing of your implants. So on your angled multi-unit abutment sites and your angled implant sites, there's a timing component built in. So there's 6 little nubs here where you can time your guided driver so you have the right trajectory of your of your temporary cylinders as they come out. So again, lining up the screw access hole in the right position, because everyone knows angled multi-unit abutments can kind of be a bear, and especially during surgery, but this helps you time everything out perfectly so the hex is in the right position, and then this will align with the carrier guide, which I'll show you here shortly, and tells you exactly where to place your multi-unit abutment. So you go through a drilling protocol. Once that's done, you remove the osteotomy guide, and now you take your carrier guide and you seat that back in, and you lock it in. Now you notice this carrier guide, it's about 2 to 3 millimeters thick. This preserves the tissue gap because of course your patient is flapped. Another thing you'll notice on the carrier guide are these black hash marks, and there's a little cutout here. That is on the angled sites. So as you timed your implant out perfectly, you take your angled multi-unit abutment and you seat the screw access or the handle of that multi-unit fits right into this little cutout and where this black mark is. So you align your screw access hole with that black hash mark, and you'll have an ideal position for your angled multi-unit abutments. The straights don't matter. You just seat them and move on. And then one more thing you might notice here, these pegs here. These pegs are going to align with the prosthesis on the intaglio. There's 2 holes that will line up with these pegs. So as you seat your temp cylinders, it locks it in. But here you're going to place your multi-unit abutments, index them on the angled, take your temp cylinders, and you'll screw in each of the temp cylinders. And now you take your prosthesis and you're going to slide the prosthesis over the temp cylinders. Another thing we include with GuidedSMILE are these block-out gaskets and block-out plugs. So you can you slide your temporary cylinder over, you take your gasket, slide the gasket over the temp cylinder. This helps prevent you from locking this prosthesis to the carrier guide, because that would be a bad day if you lock this thing as you do your pickup. But you'll slide your prosthesis over the temp cylinders and it locks onto the carrier guide. And this is going to put it at the ideal vertical, preserving that tissue gap. And then the midline's all lined up. Everything's kind of planned out for you. So now you have your temp cylinder sticking out here. You'll take your blue plugs, plug them in, take some acrylic, and you'll express your acrylic around each of the temp cylinders as you pick up. So you pick up 1 set of temp cylinders, and then we send a second prosthesis. Depending on your workflow, there's a protocol where you can pick up a second set of temporary cylinders in your prosthesis. And this can help on the restorative end. I won't go too much into that. We can discuss that later on, but you can do a second set of temp cylinders. It indexes the implants at the proper height and vertical, or on the proper height, midline, everything's kind of lined up for you. It can be used as a verification jig down the road. But once everything's picked up, whether you're picking up 1 or 2 prostheses, as they're picked up, then you're done with chrome in the mouth. So you'll remove chrome, and then you'll start suturing and get the prosthesis ready for delivery. And that's pretty much it. But that's kind of how I go through it. Hope that helps. Any questions, please give us a shout here at GuidedSMILE.